Good day, St. Maarten. I'm Yesenia Lazaro.
And I'm also Lauren.
And welcome to another edition of St. Maarten News Desk.
Brought to you by TV15.
We bring you the latest and most important stories around the island and beyond.
Ooh. Let's check out these top headlines. Prime Minister Mercelina in Washington to push trust fund projects. St. Maarten's Prime Minister Dr. Luc Mercelina is in Washington, D.C., meeting with World Bank officials to address delays in the St. Maarten Recovery, Reconstruction and Resilience Trust Fund projects. The Honorable Prime Minister, joined by Honorable Ministers Patrice Gums and Melissa Gums, is following up on a letter sent September 4th, expressing deep concern and dissatisfaction over prolonged project timelines and administrative hurdles. Key projects highlighted include the Emergency Operations Center, EOC, aimed at strengthening disaster preparedness, and the Mental Health Initiative to support the population's well-being. Other priorities, such as the rehabilitation of schools, sporting facilities, and the St. Maarten Library, are also under review. Honorable Prime Minister Dr. Mercelina stressed that continued delays undermine public confidence and called on the World Bank, in coordination with the National Recovery Program Bureau, to take swift action. Quote, "The people of St. Maarten deserve timely and tangible results from the trust fund," end quote, Prime Minister stated, emphasizing the urgency of advancing these critical initiatives. VSA hosts first Inter-Ministerial Conference. The Ministry of Public Health, Social Development and Labor, known as VSA, led by Minister the Honorable Luc Mercelina, hosted its first ever Inter-Ministerial Conference on September 17th. The three-day event brought together representatives from nearly all ministries to boost collaboration and improve service delivery. Day one focused on poverty alleviation, health in all policies, and labor initiatives, setting the stage for shared expertise and coordinated programs. Days 2 and 3 delved into health insurance legislation, mental health developments, preparations for the upcoming Aging Conference, and strategic planning for the ministry's long-term development. Minister Mercelina highlighted the importance of breaking down operational silos and thanked all participating ministers, including the Honorable Prime Minister Luc Mercelina, for their commitment to improving governance and the quality of life for the people of St. Maarten. The conference will result in a consolidated inter-ministerial document outlining collaborative actions and timelines through December 2026, aiming for more efficient, people-focused government services. Mardembrough Jr. wins gold at Olympia Latino America. St. Maarten's Calvin B. Mardembrough Jr. has once again triumphed on the international stage, securing the gold medal in the men's physique 35+ category at Joe Weider's Olympia Latino America on September 20th. Coming just 2 months after his last competition in Jacksonville, Calvin credited his success to rigorous training, additional size gains, and refined posing techniques under the guidance of international coach Sharonika Henton. "This win is a testament to the relentless support of my team," Calvin said, acknowledging the contributions of Antonio Gosilio, Christelle Zarowska, and the IFM gym community. His victory not only adds another medal to his growing collection, but also highlights St. Maarten on the global bodybuilding stage. Looking ahead, Calvin remains focused on achieving his pro card in 2026, continuing to inspire fans and fellow athletes alike. On behalf of NEWSDESK, congratulations, Calvin, and continue to take St. Maarten further. Rising costs and mounting deficits are putting St. Maarten's healthcare system under pressure. How close is the island to a tipping point? Stay with us, as in our feature story, we take a closer look.
A new day begins. The sun rises over St. Maarten, bringing new energy, new possibilities. This island was built on resilience, progress, and the strength of its people. Our connection is what moves us forward. It links our communities, our businesses, our families. From the heart of the island to the shores beyond, we've connected St. Maarten. From every street to every home, this network was built for St. Maarten by St. Maarten hands. Connection isn't just about signals, it's about people. This is your island and your network recharged. Proudly local, we're here for today, tomorrow, and every milestone ahead.
With a Sunshine Report, straight out of Sunshine City, St. Maarten, bringing you the warmth and the sunshine you need to kickstart your day. So let's dive into the forecast and see how the skies are treating us. The Met Department of St. Maarten is keeping a sharp eye on the Atlantic, ready to update you with the latest. So don't forget to follow NEWSDESK on Facebook for your daily Sunshine Report. So as you enjoy your week, stay safe, stay friendly, Sunshine City.
It's hurricane season. Are you prepared? Here are a few tips to remember to help keep you and your family safe. If you're not in an area that is advised to evacuate and you decide to stay in your home, plan for adequate supplies in case you lose power and water for several days and you're not able to leave due to flooding or blocked roads. This hurricane season, make a family emergency communication plan. This public service announcement was brought to you by the government of Sint Maarten. The Ministry of VSA, Department of Infrastructure Management, together with the Police Department KPSM, is making changes to traffic on a section of Canegita Street and Manzanella-Steeg, Phillipsburg. The Canegita Street from the intersection with Percy LaBega Street to Manzanella-Steeg will now be a one-way street. Inbound traffic can enter Canegita Street from Percy LaBega Street and drive straight ahead or turn left into Manzanella-Steeg. Outbound traffic leaving town on Canegita Street must make a right turn onto Manzanella-Steeg. Entry further into the Canegita Street will no longer be permitted. Outbound traffic exiting Manzanella-Steeg onto Walton Nisbet Road can either make a right or left-hand turn. The Ministry of VSA, Department of Infrastructure Management, and the Police Department would like to thank the public for their attention to this change. Please follow the new traffic rules and signage and drive safely.
Over 300 men screened for prostate cancer. Over 300 men on St. Maarten participated in free prostate cancer screenings on September 6th and 13th, organized by the Positive and Electrolytes Foundations with St. Maarten Laboratory Services, SMMC, Napa Outer Parts, CPS, and the Lions Club. The initiative, under the slogan Man Up and Check Up, encouraged men to prioritize their health and break stigmas around prostate cancer. Next week, the community can attend the Let's Talk About Sex 3 panel discussion on September 26th at the Lions Civic Center, featuring specialists and local advocates addressing erectile dysfunction, prostate cancer screening and treatment. Men attending will also receive Man-Up Checkup t-shirts while supplies last. The following day, September 27, the foundations will host Men's Health Day at Sint Maarten Medical Center, reviewing PSA test results and offering free screenings for blood pressure, blood sugar, and HIV. Men over 40 are encouraged to participate and take proactive steps toward better health. Partner organizations praise the initiative for its impact, highlighting the importance of early detection and community education in improving men's health outcomes on the island. Sint Maarten Medical Center graduates 4 critical care nurses. Sint Maarten Medical Center celebrated the graduation of 4 nurses from its critical care registered nurse program, enhancing the hospital's capacity to provide 24/7 intensive care. Alicia Alexis, Mykandra Simmons, Anthony Jagmona, and Sharisa Hodge completed the rigorous 3-year course locally, with Alexis graduating as valedictorian. Unlike traditional programs abroad, Sint Maarten Medical Center's tailored course allows nurses to train on island while gaining hands-on experience in ICU and ER settings. The CCRN certification equips nurses to care for critically ill patients, reducing the need for medical evacuations. Hospital leaders emphasize the importance of ethics, knowledge sharing, and excellence in patients' care, highlighting the graduates' role in strengthening the island's healthcare system. Sint Maarten Medical Center CEO Dr. Felix Holliday praised the graduates, noting their dedication and the pride they bring to the hospital, their families, and the community. USM President visits Minister Plenipotentiary. The President of the University of St. Maarten, Dr. Antonia Carmona Baez, visited the Cabinet of St. Maarten's Minister Plenipotentiary in The Hague on September 18th. Discussions focused on the Caribbean Academic Foundation Year program, which began in August with 28 students from St. Maarten, Saba, and St. Eustatius. The 10-month program, funded by the Dutch Ministry of Education, emphasizes personal development, study skills, and language proficiency to prepare students for academic and career success locally, regionally, or abroad. Dr. Carmona Baez also highlighted USM's efforts to strengthen ties with Dutch universities and regional partners. Minister Plenipotentiary Dr. Anders Gracita R. Arendel expressed her full support, emphasizing the university's role in shaping St. Maarten's future and facilitating connections in the Netherlands. Warnings from the CFT and concerns from SZV. Questions about funding, coverage, and care abroad are louder than ever. Coming up, what this means for St. Maarten's future.
Let's put everything on the table. People always give their opinion, and you can either take it or crunch it. Let them judge. We give in to the most irresistible flavor. We devour every nugget that falls in our hands, especially when it's our crunchy fried chicken. And let the crumbs fly if needed. Let them keep judging. We'll keep indulging. KFC, it's finger-licking good.
You could talk to your family, talk to your friends. Affordability and convenience. Community connection, that makes sense. Reliability with experience. Hey, for every love, every adventure. #1 provider, they got ya. We tell them your data is always on. You can opt out whenever you want. Tell them we always on. For every moment when you want more. Tell them we always on. Stay connected when you want the road. Control my data, yeah, yeah, yeah. Always connected every time, everywhere. Money low, but I never fair. I know, tell them it's there. Connectivity, that's what I like. Flexibility, that's what I like. Reliability, that's what I like. Tell them, sign me up for life. Tell them we always on. For every moment when you want more. Come tell them we always on. Stay connected when you want to go. Come tell them we always on. For every moment when you want more. Tell them we always on. Stay connected when you want to road.
Guess what? I got an idea. It's amazing. You see how we have the link sharing all everywhere?
QR link,
the
yeah.
QR link?
Yeah.
Raw Caribbean Channel app. Yeah. You're welcome. Put it in the back.
But it's not an app, though. It's not an app. App, you have to like download something to get it on your phone, take up space. It's not an app.
It's like an app. Therefore, it can be an app. So, it's an app. Raw Caribbean TV app. Say it with me, Al. Come on.
It's not an app, though. All you got to do with that, it's a link. You take the link, you hit the bookmark, you say, add to home screen, and so it shows up like an app icon, but it's not an app, though.
Are you a real person? It is an app because you get to watch all the programs from Raw Caribbean at one place. It is an app.
I don't know how to explain this to you, but factually and technically, it's not an app. Kind of like we do the news, facts,
Yeah.
and you do that thing you do.
Whoa.
Point being, you just go to the QR, you hit bookmarks, and you hit add to home screen, and then you can have the link to, let's give it another name.
The app.
You want to call it the app?
Raw Caribbean TV app.
Jess.
Yes.
Jess, please, give some sense, Jess. Jess.
It's kind of like an app.
That's why she gets the big bucks.
It's not an app, though. It's not a app. What the It's not a app.
You kiss your mother with her mouth? My God. Watch Raw Caribbean TV app.
Watch Raw Caribbean TV app.
Yes.
It's not an app, though. Good day. St. Martin's healthcare system is at a crossroads. For years, experts and officials have warned that the island's current model is not sustainable. And the latest statement from the Committee for Financial Supervision, or CFT, makes that warning even more urgent. According to the CFT, the expenses for healthcare on St. Martin structurally exceed the income, causing persistent deficits. Over the period from 2010 to 2023, these deficits have totaled approximately 500 million guilders. Looking ahead, SZV, the Social and Healthcare Insurance Organization, anticipates yearly shortfalls of 30 to 35 million guilders. For now, these gaps are being covered by surpluses and other funds, like the old age pension, but reserves are shrinking rapidly. The International Monetary Fund even predicts that liquid reserves could be exhausted by 2029 if no changes are made. Honorable Prime Minister Dr. Luc Mercelina has been vocal about the risks. His first address after taking office, he warned that without a sustainable financial system, SZV could collapse within 5 to 7 years. He emphasized that overconsumption of the current budget, coupled with rising healthcare costs, threatens both the insurance system and the broader financial health of the country. St. Maarten has been working on a general health insurance system intended to increase premium income and balance expenses. But this legislative process has been ongoing for over a decade, and implementation remains slow. Meanwhile, other measures like increased use of generic medications, expanded primary healthcare, and more careful management of referrals abroad have been proposed, but these plans are still largely in planning stages. The financial challenges are compounded by historical debts. In 2019, the government committed to paying off a 91 million guilder debt to SZV, accumulated over many years. And going back even further, agreements on leasing government buildings from SZV reflect how intertwined public finances and healthcare funding have been. Every delay or misstep has real consequences for SZV's ability to operate. So what does this all mean for residents? In short, a system under strain can lead to delays in care, reduced access to treatments abroad, and uncertainty about long-term coverage. Healthcare workers have also raised concerns about quality of care if deficits continue. The CFT's message is clear. St. Maarten must act decisively. Income and expenses must be balanced, reforms implemented, and all stakeholders, from the Ministry of Public Health to SZV and the hospital, must work together. The island cannot afford to wait any longer. Healthcare is more than numbers on a balance sheet. It affects every resident, every family, and the long-term resilience of St. Maarten. The question now is whether decisive action will be taken before the system reaches a breaking point. So as the island watches, the challenge is clear. Without bold reform, St. Maarten's healthcare system and the financial stability that underpins it are at serious risk.
So that's all the time we have for today's edition of St. Maarten News Desk.
Thank you for joining us. Remember, new episodes premiere every weekday morning at 8 a.m. on TV 15 and then across all social media platforms. I'm also Lawrence.
And I'm Jessiana Lassiter, wishing you an amazing day and evening. See you tomorrow.
Stay friendly, St. Maarten.